According to the Centers for Disease Control, breast cancer is the second most common cancer among women in the United States. The healthcare providers at New West Physicians, part of Optum, advise talking with your doctor to discuss health history, any symptoms you may be experiencing, and preventive screenings. Dr. James Yeesh tells us more.
October is Breast Cancer Awareness Month, a health observance that reminds us to be aware of the symptoms and risk factors for breast cancer. It's also a time for taking steps that may reduce the risk of getting breast cancer or finding it early when it may be easier to treat. Mammograms are X-rays of the breast, and they are especially important because they may detect breast cancer when there are no apparent symptoms. When symptoms of breast cancer develop, they may include a new lump in the breast or underarm, changes in the size or shape of a breast, thickening or swelling in parts of the breast, pulling in of the nipple, pain in the nipple area, pain in any area of the breast, nipple discharge other than breast milk, irritation or dimpling of the breast skin, and redness or flakiness in the nipple or breast. Screening recommendations vary between experts. Beginning at age 40, women can opt for annual mammograms. However, women with certain risk factors for breast cancer may need to start mammograms at an earlier age and may need more frequent screenings. Breast cancer continues to be the leading cancer diagnosed in women. For example, a few jarring stats to keep in mind are that 30% of new cancer diagnoses in women will be breast cancer, and it accounts for 12% of new cancer cases globally. Some women are more at risk than others, though, particularly if they have a first-degree relative like their mother or sister that have been diagnosed with breast cancer. But let's not forget, 85% of cancer cases do occur in women with no family history of breast cancer. Breast cancer can happen to anyone, but there are risk factors that can increase a person's chance. Because of those risk factors, those who should get a mammogram include women age 40 and over, women with a first-degree relative diagnosed with breast cancer, those with a family history of BRCA1 or BRCA2 gene mutations, women with dense breasts, and women whose menstrual cycle began before the age of 12. The American Cancer Society provides several steps to prepare for a mammogram. On exam day, avoid wearing deodorants, antiperspirants, powders, lotions, creams, and perfumes under the arm or breast. Some of these products can show up as white spots on the X-rays. At New West Physicians, part of Optum, we take breast cancer very seriously. Screenings can find cancer before symptoms begin, and 99% of breast cancer is survivable if found at the localized stage. Therefore, getting screened is important, even if you feel fine. It's a good idea to talk with a doctor about potential risk factors and various types of screenings, including mammograms.
New West Physicians, part of Optum, has been serving Denver patients for nearly 30 years. Their primary and specialty care doctors provide patient-centered care backed by Optum's leading health services and technology. They are dedicated to helping our community live healthier while keeping quality care affordable. With decades of experience, 140 providers, and over 20 clinics throughout the Denver metro area, they are ready to see you. Visit nwphysicians.com to learn more.